At Times Network India Health Summit and Awards 2025, I am being joined by Dr. Devavrat Arya. Sir is Senior Director and Clinical Administrator, Max Super Speciality Hospital, Saket. Thank you so much for joining us, sir. My first question to you is, we talk a lot about breast cancer, but I want to know what is the current situation in India. How prevalent is the disease? It is often said that India is undergoing a silent epidemic when it comes to breast cancer. So what is your take on it, sir?
First of all, thank you for having me here. Breast cancer certainly is an increasing problem in our country. If we look at the statistics, we have nearly 2 lakh new breast cancer cases being diagnosed every year. What is also important is that the numbers are increasing. At one time, cervical cancer used to be the most common cancer in women in our country. Now it is breast cancer. What's also important is, compared to the Western world, breast cancer happens a decade earlier in our country, which means that women are afflicted with this disease at their social, financial, physical peak, and that makes a huge impact on their families and on themselves.
Right. Mike, since you're talking about awareness, and I want to know why, despite such awareness at such a early detection remains a challenge, sir. Is it due to lack of awareness? What are the factors which are creating barriers for us that we are not able to detect it in early stages?
I think the lack of awareness actually works at multiple levels. One, I think there is a certain lack of awareness as to the common symptoms of breast cancer, and therefore, even if someone has a lump, it's ignored, or it's thought of as a normal variation in the breast anatomy. So women are not fully aware of the symptoms or the early signs that there could be a malignancy. Second, I think there is also a little bit of a taboo in our country, and women do not, especially in rural areas, tier B cities, they will still hide the fact that they've had a lump. I often get patients who had a lump for the past couple of years before they actually present to a doctor. So there are some inherent, reservations among women to come up to a doctor with their symptoms of breast cancer. To some extent, there needs to be an increased awareness in the healthcare personnel as well. So if a woman does present to a nurse, to a primary care giving doctor, a family physician, it needs a very high index of suspicion that a particular symptom that he or she as a doctor may have diagnosed could actually be a cancer and should be referred for the appropriate testing.
You spoke of the hesitation part, sir. I want to talk about the screening. What are the most effective screening tools today in India, and how can we encourage those women in tier 2, tier 3 cities to take up these, to undergo these screening tests?
Yeah, so one of the most effective ways to screen for breast cancer is a mammogram, which in simple words is an X-ray of the breast. Now, there is ample data to suggest that screening, if started above the age of 40 years, done once every year, if someone is more than 50, once every 1 to 2 years, actually not only picks up cancers early, is able to differentiate what could be a benign lump from a malignant one, could trigger just surveillance or may indicate escalation to a biopsy. So screening is a very simple test. Beyond conventional screening, I usually recommend that women get a breast self-examination. I think that improves awareness of their own breasts, their anatomy. There are amazing videos in most hospital sites on YouTube that women can refer to, understand what's the best way to do a breast self-examination. And if they are going to a doctor, on a 6-monthly basis, get a clinical breast examination where the doctor does the breast examination. All of this happens even if there are no symptoms, which means that you're just going and getting yourself examined or tested, and that may actually pick up lumps or cancers which may have not led to any symptoms as yet.
And once diagnosed, I think, sir, the risk of recurrence becomes a challenge. Sometimes out of ignorance, sometimes out of overwhelming response that they faced. The family, along with the caregivers, do not follow up on the checkups, sir, and the risk of recurrence is there. So how are we tackling that?
Yeah, so you've raised a very important point. Treatment of breast cancer is challenging. You'd invariably have surgery. A lot of these patients would require other ancillary treatments like chemotherapy, target therapy, radiation therapy. Some of these have their own side effects. Some of these side effects may have been difficult. The journey may have been difficult for the patients. And once a patient has completed treatment and is on regular follow-up, the mere thought that if there's a recurrence, she may have to undergo all of these again actually generates a lot of fear. Uh, you'd be surprised. Data suggests that as many as 60 to 70% of patients have an extreme fear of cancer recurrence, and you have similar numbers among caregivers also. So 70 to 80% of caregivers of survivors also have this fear of cancer recurrence. So how do we tackle it? One, obviously, disseminate information. So I encourage my patients to understand what are the possible signs that could suggest a recurrence, what is the follow-up schedule, what are the tests that are to be done on those follow-up schedules, and that empowers these patients, that educates these patients, and based on this, they are able to understand what is a risky sign or symptom and what may not be that risky. The other thing that we suggest is we actually encourage our patients to be part of our survivor groups. So a breast cancer survivor group, which comprises of people who have been through the journey of breast cancer treatment, where they share each other's experiences, they share information. Breast cancer survivor groups actually help a lot to these patients. The third thing that I usually tell them is there's no point in obsessing. So not every symptom would mean a recurrence. So there's a fine line between obsession and being alert. So it's good to be alert. To some extent, the fear of recurrence actually helps. If someone has a suspicious symptom, that person comes to the hospital, when there's a recurrence, we identify it in a timely fashion. So to some extent it helps, but obsession doesn't. Nowadays there are multiple modalities, there are online apps that are available that they can refer to. So awareness, education, discussions in survivor groups, and usage of modalities like online apps usually helps tackle fear of cancer recurrence.
And quality of life once you are diagnosed with cancer remains a key challenge. What are your how will you guide the patients in order to choose the treatment A? B, also what is the role of immunity and lifestyle? What are the role played by immunity and the lifestyle when it comes to recovery sessions and all that?
Yes, so cancer treatment, particularly breast cancer treatment, can be challenging. There is data to say that at least during treatment, there may be some adverse impact on quality of life. As a clinician working in the modern era, where I want to obviously maximize the chances of cure in each of my patients, I'm increasingly looking at de-escalation of treatment as well. So when I have a patient walking into my clinic, when I'm sitting with the patient, I'm not thinking as to what is the most that I can deliver to the patient in terms of treatment. I'm trying to understand how can I personalize treatment for each patient. Does the patient need heavy treatment, heavy chemotherapy? Can I get away? Can I do a test that can help me understand whether there is actually a need of chemotherapy at all or not? And so in a lot of early stage breast cancers, especially hormone receptor positive, we actually end up advising a test. And in about 80% of these cases, we can end up avoiding chemotherapy altogether. So there is a lot of focus along improving quality of life. If you do need chemotherapy, we would advise patients on the dietary patterns, on lifestyle changes, on precautionary medications that can ensure that side effects do not occur. If the side effects are there, they are mitigated adequately, and the patients have a reasonable quality of life. Coming to lifestyle, lifestyle plays a huge role even in those patients who are on treatment. There is enough data to suggest that women who remain physically active, even while they are receiving chemotherapy, tend to do better compared to women who are not physically active. And I personally encourage all of my patients, even when they are on chemotherapy, to remain physically active. Obviously, immunocompromise is an issue, and therefore avoidance of large crowded places is something that we recommend. Dietary practices, simple dietary practices, avoidance of too much sugar, avoidance of red meat, intake of good sources of protein, green leafy vegetables, looking very finely at the amount of calories that are being ingested, avoidance of packaged processed food, etc. goes a long way. And then lastly, eventually lifestyle after treatment also remains important, not only in ensuring that they remain in the best of their health, but also there is data to suggest that adoption of good lifestyle habits post-cancer treatment prevents the risk of recurrence.
On that note, sir, thank you so much for this insightful conversation. I hope the viewers are more informed about the breast cancer. Thank you so much.
Thank you very much. Thank you.